Hello and welcome back to UrAuntyRN. My name is Gloria. Let's get right to it. But first, if you'd be so kind as to take a moment to subscribe and thumbs up the video, I'd appreciate it. Without further ado, we're going to cover what is a nursing assistant and how to become one. Nursing assistant is an entry-level professional of the healthcare team that provides patient-centered direct care under the supervision of a licensed nurse. Now, there's different titles that all mean the same skill set for a nursing assistant, and I'll list them for you now. You have a CNA, which is a certified nursing assistant. You have an STNA, which is a state-tested nursing assistant. You have simply NA, nursing assistant, as well as LNA, which is a licensed nursing assistant. Now, it depends on what state you're issued your accredited nursing assistant certification. To become a nursing assistant, there's a typical regime of training or curriculum of training. For all of the programs, however, you have to have your high school diploma or your general education diploma, also known as a GED. You have to gain entry into a program, which usually means there's some type of basic exam that you'll have to take to test your general knowledge. You're also usually required to have a criminal background done. It depends on the state, again, that's issuing you your license. And then a tuberculosis test or the TB test, the one that's right on your arm that they read. That's very important, and that's usually generally a part of getting into the program. And last but not least, some programs require a basic physical exam. You know, when you are a part of the health team, you know we use our bodies a lot. So some programs even require a basic health exam or a basic physical. The cost of the programs. Now, on average across the U.S., I see that you come about $1,100. Some states are a little more, some may be a little less. But overall, a nursing assistant program generally averages is about $1,100 across the United States. However, and I've seen a few states that have the Red Cross that offers free or gratis free nursing training. So in some cases, you may qualify for that free nursing assistant training through your local Red Cross. It's worth seeking out and finding out for yourself. Now, a typical state-approved nursing assistant programs is at least 75 clock hours, okay? The time for the program generally ranges from 4 to 12 weeks, depending on the state that you're receiving your training in. It usually consists of established classroom academics, as well as lab time where you actually get to practice what you've learned in the classroom, and then a rotation of clinical in a facility. Now that varies, again, depending on your program and the state you're in, but those three factors, the academics and the lab with the clinicals in a facility, is your typical nursing assistant program across the board. So now what? You've gotten into your program. You've successfully completed it. What now? Upon successful completion of your program, you would want to sit for your certification and pass that. Congratulations. It's typically a two-parter to do. So it's a practical, which you would either do written or oral exam portion. Again, it's a two-parter. And then the other part is skills, showing the skills, again, that you learned in tangent with the classroom and the lab, that you've practiced in the lab. You'll be asked generally to show your skill set on those activities. The exam generally ranges between $80 to $100 to take your exam, and you need to check your program's policy on any retakes or anything like that. Again, statewide, these are typical program requirements and typical state requirements to become certified as a nursing assistant. What types of things do you do as a entry-level healthcare provider, also known as a certified nursing assistant? Well, typical tasks range from, including and not limited to these duties, but just to name a few: attaining vital signs, assisting with patient elimination, turning and repositioning, very critical on a lot of patients, assisting with feeding or nutrition. Very important, I'd have to say one of the most important things of all as a task is documentation. You're doing all these tasks, you need to make sure you're documenting these tasks. Very important. Those are some of the typical tasks that come along with being a certified nursing assistant in most, if not all, states in the United States. You want to know what kind of salary do you make? I'm glad you asked. The average salary that I've found across the United States for a certified nursing assistant is about $26,500 a year, and most of the time it also comes with full benefits. So a full-time position generally ranges about $26,500 a year with benefits, an average. Some states are as high as $30,000 to $32,000 per year, and some are as low as $22,500 or $22,000 a year annually. Next, you want to know, well, now that I'm interested in this career path, how does the outlook look for jobs? So what does jobs look like? We're in 2021. How is it worth me investing my time and efforts? Well, according to the Bureau of Labor Statistics, the projected growth for certified nursing assistants between 2019 and 2029 is 8%. So that's higher than a lot of career paths out here that take this amount of time and effort to invest in yourself and be successful at. Thank you so much for coming by. UrAuntyRN. My name is Gloria. You have a great day. Don't forget to like, share, and subscribe.